So we deliver Manjaro for weight management locally in our PCN. I work with a lead GP who often does the searches to identify the patients that are eligible, and then he will send out an AccuRx message, something along the lines of, we believe that you may be eligible for Manjaro to help with your weight. If you are interested, please respond. Once the responses come through, he will then forward the names to myself. I will then give the patients a call and just explain to them what this is about. I explain the criteria for having Manjaro on NHS prescription, the comorbidities and the weight. I'll also talk to them about any bloods that they might need before we start the programme. After we've had that initial telephone call, if they're still happy, I will invite them along to a face-to-face appointment so that we can just go through things more thoroughly. Again, we'll talk about the criteria and how they meet that criteria. Talk about how Manjaro works, any potential side effects, and that the programme initially will be for 6 months funding. If they are happy, we can start it there and then. If they want to go away and think about it, then we're happy for them to do that too. If there are any patients that aren't identified by searches, sometimes colleagues will bring a patient, they'll send a task asking whether a particular patient is eligible, because sometimes if the coding hasn't been done, there might be some patients that slip through the net at that point. But again, we can pick them up, make sure that they fulfill the criteria, and then we can invite them along for a discussion about whether they would like to consider Manjaro as a treatment for their weight. When it comes to patient expectations, it's really very important to make sure that they are aware of what is involved in the process. A lot of them think that by taking this medication, the weight will just dramatically fall off without them having to do anything. So it's really important to set the boundaries at the start, to tell them that Manjaro is a really good medication for weight management. However, it will only work alongside some changes to their diet and some increase in activity. So their diet and lifestyle are vitally important in the whole bigger picture of this pathway. When patients come to their face-to-face appointment to look at starting on Manjaro for their weight, I do go through things with them that are a mandatory part of this programme. So I'll talk to them about the fact that there is a wraparound support for them, and that it is mandated that they do attend that. This can be face-to-face or digital in the area where I work. We also talk about the fact that this is 6 months funding initially, and that if they have lost 5% of their body weight by the 6-month target time, then their funding can continue. I usually find that calculating the 5% weight loss for them is helpful, because sometimes they are worried about how much that may be and whether they can achieve that. So as an example, if they weigh 120 kilograms, then we would expect a weight loss of at least 6 kilograms in that first 6 months. I often talk to them as well about lived experience, some feedback that I get from other patients, how to cope with side effects, for example, or how to cope with the changes to their diet and increase in activity. Some people might just go for a walk around the block after food, other people might try swimming, etc. It's just encouraging them to do whatever they feel that they can do. We also talk about the fact that we can increase the dose of Manjaro if their weight isn't dropping as quickly as we would like it to be, so that we can go through the dosage steps as needed. Some people have had this medication privately in the past, and they may have got up to 5 or 7.5 milligrams. So if it is someone that has used it in the past, then I will ask them what dose they found was most effective for them. They still, however, have to start at the lowest dose and work their way back up to that. I also talk about the anticipated side effects, talk to them about that these are something that most people will experience, and that they are usually transient, so will pass as their body gets used to the drugs. I'll also talk to them about some strategies that may help to lessen this side effect. So for example, if they are experiencing nausea, then maybe to minimize the amount of fizzy drinks or spicy foods, or even the portion sizes of their meals, because that can often help to minimize their side effects. If they do have any side effects, then obviously it is something that they can then work their way through, and hopefully it will ease off as the time passes. I would advise colleagues always to seek support with your training. The pharma companies are very good at offering training locally, and some of them will come into surgery and work alongside you whilst you gain your experience and your confidence with initiating patients on GLP-1s. I think it's also really helpful to have the demonstration pens and the patient information booklets. If you can sit and go through a booklet in your own time, even at home, before you do your first initiation, just to get familiar with the techniques and the strategies that are in the booklets. And then even when you're with your patient, often going through the book page by page and saying, this will help us to make sure we don't miss anything out, and go through each step is often quite handy, and make sure that they take the booklet away with them at the end so that they can refer back to that if they have any questions. And they can't, a consultation, often they won't remember everything that you've said. So again, the patient information booklet is really handy for them to take away.